Hello, everyone. So, we're talking about erection issues, or what medical community calls erectile dysfunction. What I've learned is it's got so many different variants in terms of how it shows up in people's bodies. And I just want to talk a little bit right now about the effect that it has and what I've seen that it has on male patients that I work with. And it's so traumatizing for most people if they're chronically unable to maintain an erection. Has to do, from what they've told me, directly a sense of feeling a failure, as a man, and often walking around feeling like a fraud, like they have a secret, and that even trying to avoid intimacy. In particular, if they're really, really into somebody, and I might start working with a person who is motivated to finally get help because they're really interested in someone new. And this is one situation. There's so many different kinds of situations in which a person, is motivated to start therapy with me. However, this one is a good one because they really just want to be able to have a good encounter. And it's interesting, men use terms like, I want to be a success, or the word performance. You don't hear that from women when they talk about their sexual experiences. Interesting, it's very heartbreaking at times because a person just starts to feel really desperate and forlorn, and it really affects pretty much every aspect of their life, actually, by the time they reach out to me. And as I mentioned in earlier intro videos, that people have tried everything. They have tried just about everything they can think of before they reach out to me. So just wanted to share that maybe this is helpful for women, to just let that a myth is that this is interesting. Often when a man is having an erection issue, the woman feels that it has something to do with her, and it could be if it's a male partner with a male partner. It doesn't have to be heterosexual. That's another interesting point I'll talk about this work. However, one thing goes to the next, right? It really, a person just feels, a patient that I have, just feels that they are somehow deficient and fundamentally flawed. And so what we look at is there's a need to really share, as part of this therapy, really get into their history and maybe a little bit of understanding of how they got to where they are, but also how it really let them express the pain and the anguish it's causing, because there's really very few places in the world where they feel that they can actually really openly talk about it, and that's a first step in healing. So there's a the myth, I'll go back to the myth, is that women often think that if there's a problem a man's having, that it's because of them, that they turned them off, that the man decided they're not attracted to them. And as I started to say, I got sidetracked, but that it could be another partner. It doesn't have to be the woman. It could be a male partner. Feels like, what is it about me that's causing you to lose interest? And this is a myth, because it could be true that something turned off the partner. However, in all my years of experience, it's usually not the case, and that unless like a man is with a woman, or another man who is very critical or mean to them, that's different. But generally speaking, if that's not the case, then the person that's experiencing the issue, it's about their relationship or lack of with their own body. It's not about their partner, except for their worry about being intimate with the partner and being revealed as not being able to maintain the erection and satisfy. And that's the other fear. I can't satisfy, so therefore I feel I can't satisfy. So therefore, what good am I? What worth do I have? So these are some of the things, and so I just think it's really important for the partners to realize that it's really usually not about you. It's really about the person and their own anxiety and stress. So I think that's a very important point to make when speaking around or about erectile dysfunction or erection issues in general. Thank you.